Hi all, this is your pre-brief video for your patient simulation encounter for GenMed Lab that will be happening this Thursday at 12 p.m. I am in this video, I will let you know where you will be going and a brief schedule of the that we've come up with, and then some of the what expectations you should have in terms of the facility, the type of equipment we'll be using, as well as introducing the faculty that will be joining us from Indiana State to lead this encounter. So we will be at the Prisma Simulation Center at 55 Hardin Street Extension. It's just a quick map of that. If you go down Bull Street and take a right at Hardin Street, it will be on the left-hand side, just passing that CVS that's in that corner. So we will meet there right at 12 o'clock, preferably 5 minutes before, as we will get started right at 12. We will start in the classroom for a quick 10-minute presentation by Dr. Eberman, and then we will begin the simulations. You will be paired up with a classmate to do these, with one of you being the lead in the first round and the second person being the lead in the second round. So we will go through both rounds of simulations, then we will do a midpoint debrief and lecture and skill practice with the faculty from Indiana State. So Dr. Eberman, like I mentioned, Dr. Stacy Walker, Dr. Matt Rivera, and Dr. Beth Neal will be joining us. Dr. Winkleman and I will both be there as well, along with your TAs. So we will all be there to help you throughout the skill practice. Please be engaged and asking questions and trying to learn as much as you can from them, and appreciate that they're taking their time out of their schedule to come do these for you guys and provide some knowledge. So following that, we will do the second round of simulations, which the second partner will be lead on, and then we will finish off with a final 30-minute debrief of the entire encounter. So just so you know, once we arrive in the simulation center, this is a little bit different than what you did last time. So last time you were in a office space per se. This is a little bit different. If you look here, you will come into a room similar to like a hospital room per se, and there will either be a mannequin on the bed or on a chair that you will do an assessment on based on the scenario. And so this mannequin is computerized to stimulate real life scenarios. These simulations allow us as athletic trainers and other healthcare providers the opportunity to practice complicated procedures and scenarios without posing a risk to the patient's health. So please take advantage of this. So you'll walk in and you will encounter the mannequin, and this is who you will be doing your assessment on. So you will find vitals or what the encounter is on this mannequin as they are computerized. So that will be your patient. Please assess and do the skills that you see fit for the encounter, and then you will be coming out of the room and we will do that midpoint debrief or that final debrief after. So really quickly, this is not a graded assignment. It is worth 5%. However, it is mainly going to be us providing you some feedback and then the debrief and skill practice. The grading will come from participation, engagement throughout, as well as a written reflection answering the following 3 questions. How do you think you performed after the first encounter? What was beneficial about the middle debrief and skills practice time? And what can you translate from the entire experience into your clinical practice? So this written reflection will be you just letting us know what you felt, what you thought about it, answering those questions, and you will submit via Blackboard. You will have throughout the weekend to complete. So, and then your grade will be based off on all of that. So if you have any questions, please let us know, myself or Dr. Winkleman.